In this video, we will tell you about what is Addison's disease. It is an autoimmune condition in which your adrenal glands don't produce enough of the hormones cortisol and aldosterone. Adrenal glands, also known as suprarenal glands, are small, triangle-shaped glands that are located on top of each of your two kidneys. They're a part of your endocrine system. Addison's disease is also called primary adrenal insufficiency. Adrenal insufficiency can affect your body's ability to respond to stress and to types of hormones produced by adrenal glands, and these are cortisol and aldosterone. Cortisol is called a stress hormone as it helps the body to respond to stress mechanism. Cortisol belongs to a class of hormones called glucocorticoids, while aldosterone belongs to a class of hormones called mineralocorticoids. Cortisol is a hormone that helps your body respond to stress, including the stress of illness, injury, or surgery. It also helps maintain your blood pressure, heart function, immune system, and blood glucose sugar levels. Cortisol is essential for life. Cortisol hormone also controls blood pressure, blood sugar, metabolic mechanism in humans, and reduce inflammation. Aldosterone is a hormone that affects the balance of sodium, salt, and potassium in your blood. This in turn controls the amount of fluid your kidneys remove as urine pee, which affects blood volume and blood pressure. Both help maintain normal nerve and muscle function. Potassium also helps your heartbeat stay regular. It is first discovered by Thomas Addison in 1855. He was the first to correlate a set of disease symptoms with pathological changes in one of the endocrine glands, first described as an infection of the adrenal gland, most commonly TB. Now, instead of infection, it's most commonly characterized by an autoimmune destruction of the adrenal glands. Addison's disease happens when your body doesn't have enough cortisol and aldosterone, whereas Cushing's syndrome happens when your body has too much cortisol, hypercortisolemia. Here in this picture, you can observe the physical representation of patients suffering from Addison's disease and Cushing's syndrome. Addison's disease is rare. In the United States, it affects 1 in 100,000 people. Addison's disease occurs in all age groups in both sexes, males and females. It can be life-threatening if not treated on time. 6 to 110 cases diagnosed per 100,000 in the world per year. 1.4 million dead per year in all around the world due to this condition. Addison's disease can affect people of all age groups, but it's most common in people 30 to 50 years old. Addison's disease can affect people of all age groups, but it's most common in people 30 to 50 years old. People have autoimmune polyendocrine syndrome, a rare, inherited condition in which your immune system mistakenly attacks many of your tissues and organs, are much more likely to have Addison's disease. Your mucous membranes, adrenal glands, and parathyroid glands are commonly affected by this syndrome, though it can affect other types of tissues and organs. People who have the following autoimmune disease are also at higher risk of developing the autoimmune, most common form of Addison's disease: type I diabetes, pernicious anemia, Graves' disease, chronic thyroiditis, dermatitis herpetiformis, vitiligo, myasthenia gravis. Stay connected for more healthy updates. Do like and subscribe our YouTube channel.